There's been a lot of exposure about some programs that have really run their business and their practice the wrong way. They were focused on creating a high volume of patients.
Kind of an assembly line.
Kind of an assembly line.
Yeah.
Yeah, I think that's fair to say. Their focus was more on volume throughput, and these are human beings.
Sure.
Unfortunately, they viewed it as volume throughput more than care for the patient. And although the results of these surgeries are compelling and you can attract a lot of interest, you need to approach this in the right way.
Sure.
Care for the patient, careful surgery technique, not rushing through.
The patients need to stay overnight?
Can appropriately be an outpatient surgery. And that was what some of these surgery center models are built on, the outpatient surgery center.
But there are different types here: gastric bypass, sleeve gastrectomy, lap band,
plicated band. We can talk about
and
that.
And the liposuction.
Liposuction
is the least, would you say, invasive?
Yeah, liposuction I would put in an entirely different class of procedure.
But the liposuction, if it takes a big belly fat away, doesn't that lose weight?
It's really incapable of taking a big belly away. What it's designed for is really for sculpting. So there's really a limited amount that it can do, and it's really purely a cosmetic procedure class.
That's different
of
class.
Its own.
Gastric bypass is not the most aggressive.
I would consider gastric bypass as the most aggressive surgery. It includes dividing the stomach into two parts, reconnecting the intestine to the newly formed stomach. So it makes your stomach smaller and it reroutes the flow of nutrition through your intestine that it makes a new connection to your stomach.
Is the upshot of this, doctor, that you don't get as hungry because you get filled up faster?
I think
smaller or...
Absolutely. I think one of the most important mechanisms of weight loss that these surgeries will talk about, most important mechanism is reducing hunger. And that's really valuable because anybody who's tried to lose weight, they can stick to a weight loss program for days, weeks, even perhaps months. But the hunger is always there. And the hunger is not just in your head, it's communication between your gut and your brain.
Talk about then the other types, how they differ.
So we can consider gastric bypass as the most aggressive surgery. We'll consider the lap band as the least aggressive surgery, and that is because it doesn't change your anatomy at all. It puts a silicone adjustable ring around the top of your stomach. So it controls your hunger by compressing the top of your stomach, not dividing the stomach, not rearranging your intestine, but just by compressing the top of your stomach. In of itself, the lap band is not a dangerous operation at all. In fact, it's probably the most safe operation of the options.
Also, then, if you could run down sleeve gastrectomy and the plicated bands.
The sleeve gastrectomy, what it does is we remove a significant portion of the stomach. And we do that by dividing the stomach and removing about 75 to 80% of it. And what this does is it creates a narrow tubular type of stomach where the food that goes through it will stimulate the stomach and make you feel full quite early in your meal. Also, just by removing that significant portion of the stomach, that has a dramatic impact on your hunger drive. Gastric bypass, sleeve gastrectomy, and the lap band, we have a major impact on controlling your hunger, and we also have a major impact on controlling portion size because when someone will eat, they'll feel full quite early in their meal. The gastric bypass will have the most weight loss and the quickest weight loss of the three. The sleeve gastrectomy, also quick weight loss, slightly less than the gastric bypass, and the lap band, slower weight loss compared to the others, and also statistically less weight loss.
Okay, and that fourth type, the plicated band.
Plicated band is an interesting innovation that we've been exploring, and we've been doing this procedure for 7-8 months already, and we're seeing good results. And what it is, it's a band operation where we, in addition to placing the band around the stomach, we also change the anatomy of the stomach by folding it in on itself. We do this with sutures by sewing the stomach, but we don't divide the stomach or remove any stomach like we've done with the other operations. So it's still quite appealing. It retains a lot of the character of the band in not removing any stomach or dividing the stomach. And we're seeing early results that not only does it accelerate weight loss, but we get typically more weight loss than compared to the band alone. With weight loss surgery, you really want to choose a doctor not necessarily based on any ad campaign, not based on a fancy jingle or a catchy jingle. You really want to investigate not only the surgeon himself, but the program that he's associated with. I think a very good first look at a surgeon and a program is by looking to see whether they are part of a center of excellence or not. That's an important designation.
And you can ask for that.
And you can absolutely ask for that. It's a designation recognized actually by the Medicare services, so that's actually by the U.S. government. It's a designation based on volume, experience, outcomes, infrastructure, so that the surgery is being done the right way.
So these are the questions you want to ask.
These are the questions you want to ask.
And when you shouldn't get weight loss surgery, there are people that really are not necessarily suited for this.
That's correct.
Getting it done.
Right. I think a good way of considering this is that weight loss surgery done appropriately is for a certain amount of overweight, and there are very, very clear measures that
you go by the
body mass index. Now, if anybody doesn't know what the body mass index is, it's very easy to calculate. All you have to do is plug in your height and your weight. Typically, a body mass index of 35 is a cutoff for which insurance companies will pay for your surgery. So I would say if your body mass index is too low, for example, if your body mass index is below a 30, and that puts you in a category of just being overweight and not obese, that weight loss surgery is not necessarily appropriate.
Yeah. We have a sports guy here who's had this surgery, and back to his
original weight.
Yes. Why? Why does it not work for some people? Is it because they continue to eat?
Yeah. Unfortunately,
or are they people built this way? That's what they're.
It's a very good question. Very good question. So, unfortunately, there is about a 20% failure rate. Failure being that someone doesn't lose as much weight as they expect, or they regain their weight. And I'm sure a lot of people know others that have had surgery and have regained weight. And the important thing is that along with weight loss surgery, habits have to change. A new way of eating, a new way of being active. A good program that we talked about before will include a nutritionist that will teach you a new way of eating. And if someone doesn't change that and doesn't take advantage of this opportunity, the weight loss surgery that can help you change the way you're eating, and if someone goes back to habits where they're snacking on unhealthy foods throughout the day, they're not going to succeed. There's just no way they're going to succeed.
Do you usually consider above 35 morbidly obese?
So by definition, body mass index above 40 is morbidly obese. 35 would be a cutoff of severe obesity, and typically people have medical conditions like diabetes, high blood pressure, and other severe illnesses that go along with their weight. So these are people that really need surgery to help them resolve these medical conditions. And that's really what we're after. Improving health, resolving medical conditions, requiring less medications over the long term. That's going to be life-saving. That's going to be life-saving. Now, people with a body mass index, let's say less than 30, where the benefits might not outweigh the risks, these are people that really should try these behavioral changes.
Are these procedures too new to calculate what is the average life
not too new
extension?
At all. Not too new at all.
How many years does it add then?
There have been studies that show, for example, gastric bypass surgery extends life. There have been studies that show that people of similar condition, weight and medical conditions, compared one group that had surgery and another group that didn't have surgery and were just medically managed for their weight and medical conditions. They were dying earlier, in some reports up to 10 years earlier than the people that had the gastric bypass surgery. So there are studies with the gastric bypass surgery.
Dr. Korman, Chief Surgeon, Marina Del Rey Hospital. Thank you for being with us here on Money 101. Appreciate it.
It's been my pleasure. Thank you.